How do you come off your systemic HRT? So your patches, gels and sprays, should you suddenly stop or taper it down? If your doctor or menopause specialist has decided with you that you might want to try stopping your systemic HRT, and that's known as a trial without hormones, it is suggested that you try a lower dose for 3 to 6 months first, unless you've been advised to stop immediately. And that's because you could have had a new diagnosis, such as a blood clot or breast cancer. In those situations, when your medical history has changed, such as you've got a new diagnosis of breast cancer, then you could be told to just immediately stop all your systemic HRT. Now, NICE tells us that there is no long-term difference between stopping gradually or stopping abruptly, but weaning off, so tapering down the HRT, is less likely to cause rebound symptoms. And for those really wanting to look at the data behind that, there's a really good article in the British Journal of General Practice that looked at what is the best way to try and ask patients to come off it. And yes, we need a bit more evidence, but it was a really good article that broke down exactly how we should be trying to reduce different types of HRT, and let me go through that with you. So when we talk about reducing the dose, it means reducing the daily dose. Estrogen, such as this, or estrogen that you're taking in your patches, is broken down in the body quite quickly. So don't cut it down by taking your medicine on alternate days, as this will cause fluctuation in your estrogen levels, and if you have a womb, that will cause a fluctuation in your bleeding pattern as well. So if you're using patches and you want to wean down, you can ask for a lower strength or simply cut the patch in halfway down the middle. So it's better to cut the patch and stick it on. You might need some Tegaderm in order to help you do that. Or just ask for a reduction dose in the patch and have a discussion with your doctor. Now, if you want to reduce it down even more slowly by taking, say, a third or a quarter, you can still continue to cut. Now, my pharmacy colleagues will kill me for saying this, and they'll say, look, the preparation is unlicensed, but it still does work extremely well. Just make sure you're doing that with your GP and also liaising that between your pharmacist. If you're using a gel, you can reduce the number of pumps, and if you're using one pump only, you can squirt the whole dose and only use half of it, and so reduce down that way. If your HRT is tablet form, some people it works really well. It's likely that you might need to use a low dose formulation, and it could be that you need a pill cutter to cut these. So go from 0.5 strength of the tablet is the lowest and the effective dose. Again, talk to your pharmacist. If you're on estrogen only preparation, along that you're taking Utrogestran, such as your progesterone. But if you're on, say, sequential or cyclical HRT because you're perimenopausal, then it's recommended you finish the 28-day cycle to avoid early bleeding. If you're taking Utrogestran alongside your patches, gels or spray, and that's the estrogen component of your HRT, then all you need to simply do is stop taking the Utrogestran when the estrogen part has stopped being taken. Because remember, the Utrogestran is for endometrial protection, as well as helping things like sleep and your psychological symptoms, and the estrogen is the active part. And so as long as you stop this, you then can stop this at the same time. As always, while you're tapering down your HRT, it's vitally important that you keep a track of your symptoms. So get a menopause symptom checker, because any of those symptoms that come back tells you that a trial without hormones is not something that you're ready to do yet, and it's well worth discussing that. So you know your body the best, and then you'll know whether stopping HRT is right or not. As always, if there's any questions, leave them down below.